Hi, I'm Stephanie Vance, VP of Research at AYTM, and I just want to check in and give a brief update on our consumer tracker that we've been running to understand behavior during this 2020 spring and summer of upheaval and change. One thing I would note before diving in to this most recent week's data is that this tracker wave was fielded on May 21st and May 22nd, which was prior to the arrest and death of George Floyd and the wave of protests that have since followed. As social unrest continues to grow, this is, of course, something that we are interested in, both as citizens and as researchers. We want to understand and follow that, and you can expect to see more data and insights around that. But for now, we're in late May with our trackers, so that's what I'll be focusing on. So returning to that time period, which for many of us, feels like a lifetime ago, here we are. One thing that we are finally seeing in our tracker data that is true really across the month of May is that Americans' overall concerns around COVID-19 are slowly but consistently beginning to drop. I would say concern was at its peak in April. We saw that 76% of consumers were very or extremely concerned about the COVID-19 pandemic. But by mid-May, that proportion was at 62%, and now we're down to 57%. So we saw a 5-point drop in this most recent wave. Among older Americans, these concerns are predominantly health-related, but among those who are under 60, we see that economic concerns are outpacing personal health concerns, as working-age Americans are navigating the economic fallout of COVID-19, including reduced work hours and just outright job loss. When we ask consumers to look forward 30 days and tell us where they project things will be, in March, we saw people indicating that nationally and globally, they expected things to get worse. In April, expectations were that things would be better in 30 days. And then in May, what we see is this kind of divergence in people's projections. About 40% think that things will be better in a month, and another 40% think that things will be worse. So we'll continue to watch this trend since we see so much kind of change and upheaval in data on that metric. COVID-19 impacts to daily life have begun to diminish, likely due to two different things. One is reopening efforts, right? We know that people are out and about more and that the impact on their lives is beginning to change. But I think there's also something going on as relates to psychological adjustment to our new normal. People have been living this way with restrictions on how they can move around socially, social distancing, for over 3 months now. And over time, it's not surprising to see a level of adaptation. One interesting thing that we've seen over the course of the tracker is that early on, March and early April specifically, Americans expected everything to be back to normal in, on average, about 6 months. But each week since then, we've seen that number continue to grow and grow steadily as reality sets in. At this point, the average expected back to normal timeline is around 11 months. And like I said, it's just been growing steadily over the course of the tracker. Let's wrap up with some data around reopening. As we are about 1 month into reopening efforts, and that depends, of course, on where you live and where you are in the country, we see that perceptions of reopening are pretty variable. Most consumers fall into two camps. Either they think it's the right time to reopen, as long as we're prioritizing public health, or they think that it's too early to be reopening. And interestingly, perceptions that it is too early are highest among those who are 18 to 29-year-olds. So it's really younger folks who are doubtful about the appropriateness of reopening at this point. We did also ask our survey takers to tell us about how their behavior is changing in the face of reopening. So if you recall it all and you've kept up with our tracker, you know that we asked a lot of questions about behavior change as relates to social distancing and mandates about staying at home. And now we're doing the opposite. As states reopen, we're trying to understand how behaviors are changing again. And what we find is that among behaviors that were largely stopped due to COVID, and these are things like dining out at a restaurant, shopping in stores for non-essential items, gathering with friends and family, going to the hair salon, going to the gym, taking your kids out of daycare. We're trying to understand which of those are most likely to be restarting during this nascent reopening period. And what we find is that gathering with friends and family and visiting a hair salon are the activities that are seeing the highest reuptake. So if you didn't know it before, you know it now. Hair care is important, almost as important, it would seem, as gathering with your family and your friends. So that's it for me today. As always, if you have any questions about this research or about conducting your own research, please feel free to, and we would love for you to reach out to us. And then finally, I just wanted to say, on a more serious note, on behalf of myself and my AYTM family, to all of our Black colleagues, our Black coworkers, our Black friends, brothers, and sisters, we stand with you.